Hi, I'm Sharrie Harlin-Davis, program host for Reid Beside You. And joining us today, we have Dr. Kyle Langfitt from Reid ENT, and we are talking about Audiology Awareness Month. So welcome, Kyle. And before we get started, please tell us, how did you come to Reid and also specializing in audiology?
Yeah. So I came to Reid. This is my first job out of college. Before entering the profession of audiology, I was an American Sign Language interpreter in the public school system. I come from Florida. So I spent about 10 years doing interpreting, and I worked with kids predominantly, and I think that work with kids, deaf and hard of hearing children, got me thinking about what I wanted to do differently. To address some of the needs that I saw. And I thought that audiology is a profession that meets parents and families where they are when they receive a new diagnosis of their newborn or young child. And I wanted to play an active role in that part, not necessarily the interpreting part down the road. That's kind of how I got into audiology. And Reid was the first job I interviewed for. I loved the team of audiologists, the ENTs that I met. The onboarding process, meeting different departments of Reid, and everyone just really made me feel welcome and felt like this is a great spot to start my career. Also, my family lives kind of in Dayton, so they're happy that I live close and no longer 13 hours away. So,
well, that's great, and we want to welcome you to our community and to Reid.
Thank you.
So, what is audiology?
I would say an audiologist is a specialist of the inner ear. So when we think of the inner ear, we've got the hearing portion, but also a balance portion. We learn about how sound travels through the entire ear, outer, middle, inner, and then how that sound moves up to the brain and is interpreted by the brain. Adjacent to that is that balance organ. So our ears play just one part of that kind of tripod of balance. You've also got things like vision and your posture and joints and things like that. So we're really focusing on the inner ear and how our brain is interpreting that information that comes there or comes up, and how things like hearing loss or things that might cause damage to that inner ear, what's the consequence? What do we do to compensate for that?
And when you briefly mentioned about the balance, often people don't associate their hearing or a loss of hearing with balancing.
Yeah, so audiology, audio is sound, so I think that's where the profession might have started, and then, since they're very close together, they share the same pathway up to the brain, kind of took hold of that entire kind of organ.
So when would a patient see an audiologist?
I'd say if someone, you've had an interview back in 2017 with Dr. Wolsifer, and I think she described it really well, is that most times people themselves who have hearing loss or difficulty hearing because of maybe something gradual, age-related changes, they aren't the first ones to notice or come to terms with that, because they don't hear, so they don't know what they're missing. It's mostly family members or their people around them that will kind of notice those things, having to repeat themselves or notice that you didn't quite catch what I said, misinterpreted what I said. I think other signs might be turning up the television volume, other devices. So it's usually family members or other people that are pointing it out, and then that person then finds their way to audiology. And oftentimes that happens, I'd say 7 to 10 years is what the research shows. People wait that long before they're willing to come to an audiologist and have a hearing test. Not necessarily to do anything about it, but just to even come in the door and say, what do I have a hearing loss? What is my family talking about?
And as a person who in the 2017 interview, I thought everything was perfectly fine. And then I started to get comments that you have your TV up loud or your music's really loud. And then I realized I was talking to my boss at the time, and there would be times I couldn't hear her.
Yeah.
She had a very soft voice, so there were different things I can hear. So we have the annual Reid employee wellness event, and I said, well, maybe I'll just get a check. And now I have my handy dandy hearing aid. So,
Yeah.
And so, but believe me, I fought it.
Yeah.
And I can't believe the difference in hearing.
Yeah.
So, but like most people, you will say that I just refused to believe it at the time.
Yeah.
But once I was fitted, and the sound is completely different.
Yeah.
As well as now, if I go into a room, or if I don't have the hearing aid in, how much the TV. Once I do put the hearing aids in, the TV
Yeah.
is like so loud.
Exactly.
So,
Yeah.
and another thing I didn't hear were birds.
Oh, really?
Like mine was it was inner ear, so it was high pitched. So.
Yeah. I also find that people will say, I hear, speaking of people speaking softly, and another thing people might say is that people are mumbling. And to your point about that high pitch inner ear type of hearing loss, is that you certainly hear parts of what people are saying,
Yeah.
but you're not hearing the clarity.
Yes.
And so that's why, especially those high pitched sounds are soft anyways. And when someone's talking to you, I think typical hearing people who have no issues with their hearing will get into habits of communicating across a room, or from the kitchen or the living room, another bedroom. And that's just how we're accustomed to talking. And then as things change, as hearing loss comes with age, 60s, 70s, 80s, those things aren't realistic anymore, and we have to adjust the way that we talk to people and communicate, being in the same room, getting someone's attention. That way they're ready to receive, because sometimes when you have hearing aids, you can hear much better, and that's the solution. But sometimes even if we make the sound loud enough, the clarity and the understanding is not 100%. So we aren't making the ears 20 years old anymore again.
Right.
We're just trying to compensate, give you more to listen to, and giving your brain a better chance at catching what was said.
So when do you see an audiologist?
Yeah.
When you get complaints from your family?
Yeah. Sometimes we also have a working relationship with ear, nose, and throat. So those surgeons and physicians, we're in the same building. So oftentimes if there are other complaints, other medical complaints, things like drainage coming from the ear, pain in the ear, maybe a ringing sound that is loud on just one side. Those are indicating that there's probably some medical reason for those complaints, and hearing loss might just be something that happens alongside that. So we'll oftentimes see people for hearing tests who aren't necessarily looking to hear better, they're trying to resolve a different type of symptom. So oftentimes we'll see them for a hearing test right before they see the ear, nose, and throat.
The another reason, one of the things that came up with feeling dizzy,
Yeah.
or lightheaded.
Yeah. At Reid, I think that we often find that those patients who are dizzy, and that's their main complaint, or a complaint in general, they'll see ear, nose, and throat as well, just to make sure that we rule out the medical, something medical that could be treated, because that's what ENT will do. The actual diagnosis and treatment for that can be done by an audiologist. And I think that in most cases there are certain symptoms like lightheadedness, which aren't necessarily ear-related. That might be something more maybe cardiovascular or neurological. But audiologist is trained to gather that case history and learn more about what's going on, and then to say, that sounds like an inner ear type of thing, or that sounds more in someone else's wheelhouse, so let's get you there.
Okay. So what does an audiologist treat?
Yeah. So when it comes to, again, that inner ear, you've got the hearing and you've got the balance. The most common type of balance issues are going to be things that, like vertigo, like that spinning sensation. And the most common type is something that happens very short, and usually with quick head movements, like lying down into bed. And that treatment just requires repositioning of the head to kind of get things back into place. it's a little bit more in detail, so I'll reserve that for those people who need that
Okay.
counseling. So that's primarily as far as the balance. We do a lot of diagnostic when it comes to balance, figuring out, is there a difference between the ears that might be causing their dizziness symptoms? And again, we'll work in tandem with ENT. As far as the hearing side, hearing aids are just one solution, but by no means is that the only solution. It's not a one-size-fits-all. Sometimes, like I said, when a hearing aid is loud enough, but the clarity still isn't there, we're looking at things like a cochlear implant.
Okay.
Or perhaps someone's hearing loss is not inner ear related, but maybe it's the middle ear where those bones or the eardrum is not moving like it should. So the inner ear is fine, but the middle ear is the concern. And so something like a bone-anchored hearing aid might be a better solution than a traditional hearing aid you'd put in the ear.
Now that actually requires surgery, correct?
Yeah, a bone-anchored hearing aid would.
Okay.
You got it. There's also a bone-anchored hearing aid that's actually just an adhesive that sits on the back of the skin, so there's no surgery there. That's kind of reserved for a certain type of hearing loss where there's no concern with the inner ear at all. So, yeah, most of the time surgery, but not always.
Okay. The one of the things, and I'm very curious because you were saying that you also treat with children.
Yeah.
So, what are some of the interesting or the challenges that you're working with? Because often they can't communicate what they need.
Yeah. So you've hit the nail on the head. It's kind of trying to put together a puzzle.
Okay.
We do a variety of different tests, and we're always looking to see if these two things or three or four things kind of make sense with each other. So that's why I like pediatric audiology, because I'm talking with the family. I'm getting just a bunch of information from the test and the conversation to kind of understand what's going on. Children don't respond. So a lot of the tests that we're doing at, in infancy, newborns get a newborn hearing screening. Obviously, they don't raise their hand. We just kind of measure responses from either the inner ear that sends a signal back out to show that it's healthy, or to measure how the brain is responding when sound is presented. And those are things that we do when the baby's asleep. They don't have to do anything for that.
Well, on that same note, I'm sure that it's a joy when you're finding solutions for the parent as well as for you. So.
Yeah. I think that oftentimes parents don't, everyone has kind of their own experience, and though it's hard to understand what a hearing loss, the impact of that, what are they really hearing? Mm-hmm. And so because I work with, a variety, and I kind of understand that abstract, and I can make it more simple for them to understand. There are ways that I can present, an example of what they might be hearing through like a simulator. So I really enjoy working with the parent or the caregiver.
Could you explain what the simulator does?
Yeah. Mm-hmm. So there's a machine that we have where I can put the hearing test information into, and it will, based on what pitch, so a low, medium, high pitch sound, just like we would do a hearing test in a sound booth. Mm-hmm. We get that same information from those tests where the baby's asleep. I can put that in the simulator, and it runs just a random, like a conversation, and then it will apply that hearing loss to that conversation. So when I run it, normal, you would hear it just as you would, and then it kind of takes out some of the sound. And then you realize, it sounds, I can see where they're only getting part, and it's not entirely clear what's being said.
So you also become an investigator.
Yeah.
So that's what it sounds like. When you have, what are some of the services at the Reid Hearing Center?
Yeah. So we've kind of talked quite a bit about the diagnostic services, mm-hmm. both hearing and balance. We also have the hearing aids is a big part. cochlear implants, bone-anchored hearing aids, balance testing. I think that, diagnostic hearing services includes both adults and pediatrics, and it's a lot of different components that go into that type of appointment.
Then how often do people come for, if you're adjusting to the hearing aids,
Yeah.
or if all of a sudden you're not hearing as well, then you can come into that office for adjustments? You have a whole team just do that?
Definitely. So what it looks like from, let's say someone gets a pair of hearing aids from our clinic. Usually we have that fitting appointment when it's already been decided, they've made their decision, the fitting, and then we follow them for a few months after that just to make sure things are comfortable. But it's not uncommon for things to change over 5 or 10 years, whether that be the hearing aids need to be cleaned, or maybe the hearing aid breaks because it's a piece of technology, and technology can break sometimes, especially if it's being used every day. Another thing might be a hearing is changing, and so we should adjust the volume to compensate. So we offer services like maintenance services for hearing aids and other devices too. So even if we didn't dispense them, we can still have the parts and pieces for many types of hearing aids.
I know I have a charger.
Yeah.
And somehow I clicked something, parts of it are stuck in the charger. So then I wasn't hearing anymore. So I had to bring that in, and after like an hour or so, it was done. And
yeah. So, yeah, technology, it's great when it works.
Yes.
And I'd say for most people it works really well throughout the day, but there are always things that can, whether it be the technology piece itself, or maybe we just have to educate again and counsel and kind of teach someone how to use it effectively. So.
And that's just within general with people. And so, and the other part is it's such a new thing that there's no dumb questions.
Exactly. Yeah.
And often it's like, I'm not sure, but, and the office has been wonderful on just say, that's fine. And just bring this in, we'll go over it and doing adjustments. Yes.
What a lot of people will say is, I'm not tech savvy. And to be honest with you, hearing aids, prescription hearing aids, are very techy devices. They're doing lots. You have little computers on your ears that are processing sound and doing lots of things in a very quick, short period of time. But just because they are filled with technology doesn't mean you have to be tech savvy to use them.
Right.
So they can be as simple as just put on and wear, or there are options for people to play around and tweak, and make adjustments themselves. And, people, for example, if they are really into music, they might appreciate the ability to control that. Whereas someone who just, is primarily wanted to have a one-on-one conversation, they don't really need to touch much.
One of the points we have, I have my phone app. It's an app on the phone.
Yeah.
And I always say they're the best earbuds ever, because I can adjust the music how I want it, or just the sound.
Yeah.
And so it depends, and also it can depend on the surroundings that you're in. Sometimes if you're in a restaurant, you need to turn it up or turn it down, and get rid of some of the background noise.
Yeah.
So that's always pretty interesting.
Yeah.
Another thing, well, I know we didn't plan on speaking on this, but you were saying have you ever had to have like people moving from sign language to getting a hearing aid?
So I'll say that in my experience, let's see, that's a good question, because we think about prelingual deafness or postlingual deafness.
Okay.
And so prelingual meaning usually before, at birth or very early on, there's, hearing loss or deafness there. And from that aspect, there are, we talk with families and we kind of give them expectations about what hearing aids would do, what cochlear implants, if that's an appropriate route, and the expectations with that. On the other side, you also have people who spent their entire lives as a hearing person and then for one reason or another have lost their hearing, perhaps in one ear totally or both ears. And as you can imagine, that's a very big lifestyle adjustment. And I'd say even with, say if someone lost their hearing tomorrow and they got a cochlear implant, their prognosis or their ability to do well with that device is very high, but it's never quite the same compared to what they had before. So I think that when someone, if they've lived their entire life as a hearing person and then they have a hearing loss that is that severe, they kind of start to experience the world in a different way, more visually, having difficulty in places that they didn't before. So for example, I had a sudden hearing loss on my left ear, and even though a hearing aid would not kind of help in that situation, I still experienced quite a bit of difficulty in those noisy places, and I never had a problem before. And so I kind of realized like, oh wow, this is what people are feeling when they can't hear, having to ask someone to repeat themselves and that sort of thing. So I think it depends on which side of the fence, the postlingual, someone who's already been hearing all their life, versus prelingual.
Another thing, do you find was hearing loss hereditary?
Certainly, there's genetic factors. There could be congenital from, hereditary I'd say is genetics, but there certainly are things that can cause hearing loss from birth. Genetics I'd say, it's more of a smaller group. If you think about all hearing loss, I'd say the majority of hearing loss is going to be that age-related. It's called presbycusis.
That's what I have. But I did want to admit to the age loss thing, so.
I'd say just like anyone who wears glasses, anyone who needs to use a wheelchair, anyone who needs to use a cane or a prosthetic, those are things to help you access the world and communicate with people, and I wouldn't assume that anyone would be ashamed about their glasses or having to use crutches when they break their leg. So I view that the same with hearing aids. Is I'm not hearing you as well, and I'm just using this to converse with you better. So
I'm going to use that from now on.
Yeah.
So we've talked about what your people that you treat. Is there a specialty that just brings you such joy?
Yeah. Like I said, I really like working with pediatrics because of the conversations I get to have with parents and building that realistic sort of expectation. Most hearing people have never met a deaf person in their life. And if you have a child who, you have expectations about what they will be, just like me, I want them to like the same things I like and all those types of things, and then kind of hit with this big surprise. It can be difficult for them to process, and I like to be there for parents to help them understand, because I have experience working with deaf and hard of hearing children. I know what their day-to-day lives look like, especially if you have, a deaf child inside of a deaf family. That entire dynamic is something that a hearing family would never know, and so I like to bring kind of that piece to them.
Okay. And real quickly, I know some of the laws are changing, and over-the-counter hearing aids are in the news.
Yeah.
Any thoughts on that?
Yeah, over-the-counter hearing aids have been kind of a long time coming. I think there certainly have been products out there available for many, many years, and they've just never been able to call themselves hearing aids technically. They've been amplifiers or personal amplifiers. So I think what's going to happen now is that over-the-counter hearing aids, I'm sure everyone who is watching the news has probably heard. They're for adults who are 18 years or older, who have perceived mild to moderate hearing loss, which is kind of in air quotes because it's really hard to know, do I have mild to moderate or what's going on? So I think what we can expect is a lot more products available, and at this time I have no idea what they will look like,
Right.
How they will function, but I'm excited to see because I think that product can be very helpful for people who have situational hearing difficulties. We've kind of touched on some of the signs and symptoms would be having a hard time hearing and background noise, thinking that people are mumbling. So I think that's a really good entry product for people to try, especially if maybe they can do it risk-free with a return policy in place, just to kind of experience and see, oh, wow, I was missing this or that. And if they're looking for something different, then they know, who to see next.
And as we're winding up, we have making sure we have in satellite offices with Reid. So they're in Greenville, Newcastle, Connorsville, and coming in December, Winchester.
Yeah.
And if someone wanted to make an appointment to see you, we have information that, and you're actually in the Reid ENT building, and we have your contact information.
Yep. So that would be the phone number for the Reid Hearing Center.
Okay.
You just call them, and maybe you have a pair of hearing aids that aren't working well for you. Maybe you got an over-the-counter hearing aid and you want to learn more about how to use it, or you need counseling. Or maybe you just your family member is nagging you, and it's time to bite the bullet and just kind of see where things are and get a baseline.
Oh, great. Well, we want to thank you, Dr. Langfitt, for visiting with us today.
Yeah.
And thank you for joining us on Reid Beside You.